will hand it over to Helen for any introductions, and we'll proceed.
Okay, so first of all, on the agenda is public comment. Do we have anyone who would like to offer public comment this morning? Right, hearing none. Just a quick reminder to anyone, because this is an all virtual meeting, if you are not speaking, please do mute yourself to minimize the background noise. We do have two guest speakers this morning. First of all, Jennifer Collins asked for a couple minutes of time to discuss a current issue at Langston Brown. And then she'll be followed by Candace Lopez, who's going to give us an update on the activities that Project Peace is up to. So Jennifer, the floor is yours.
Good morning, everyone. Just wanted to give you a quick update in case you're hearing any buzz in the community, especially from participants or community members that go to the Langston Brown Community Center. Most of you are probably familiar with Langston Brown. It actually is one of our 55+ center locations. It's also one of our congregate meal sites, our social 60+ cafe, and it's also a public high school. So like 2 years ago, and since it came back, I think the new school's been, they used to be a new school, 18 years, because it was reopening about the same time I started with the county. And it's always had the community center with senior center also during the day, and the high school going on. Usually it was senior center on the first floor and a few programs on the second floor, and the school was mostly on the third floor with some things on the second floor. I think everyone's probably aware, nationwide there's issues with school security, and Arlington Public Schools has had some changes, and new security people, I believe, have come in the last year or so too to look at everything. And Langston was kind of one of the last ones they really kind of looked at, because it is one of the only ones that's shared space during the day. And there were some concerns because with us having programs, with DPR having programs on the second floor, and most notably there's a senior weight room program that takes place Monday, Wednesday, Friday from 11 a.m. to 2 p.m. and that was just senior only time. Any other community time took place after 3 o'clock after schools was done. Well, new principal came in a couple years ago. There was the New Direction School, which I believe is a court-appointed school for students, had also joined the Langston School. And so the two schools merged. They actually took over another room on the first floor, kind of limiting the space for the community center during the day. But all that said, seemed like students and seniors during the day were working well together, but now APS and DPR have been working together because they do have an MOA on the use of the space, but the Arlington Public School has a policy about the public not being with students during school hours. So with us having the weight room, specifically I'll speak for the senior program, having the weight room on the second floor, and students have lunch at the same time over near which is right across, there could be times where they're crossing. We've never had an issue, but now it's it's a safety concern. So we've been asked to no longer have the senior fitness hours during the day when school is taking place. So as you can imagine, this has made a lot of community members upset. It's not a huge program. We have the same program at Madison, but it's not a school, but Madison's different. It doesn't have the same public transportation that Langston does. So we did have a meeting with schools, and the Langston Brown Advisory Committee called a meeting on Friday with Arlington Public Schools so they could explain the reasoning behind it, and DPR had staff there too. So and I know there had been comments going, community talk going on about this on Nextdoor. Helen actually sent it to me because I live in Fairfax. I don't have the Arlington Nextdoor, but so there'd been a lot of stuff with that because we had posted it right after Thanksgiving that this was going to be, I'm sorry, I back up, because what's going to be happening is come January 3rd, when everybody comes back, is when it's going to stop. We'll no longer be able to have the senior weight room program. So of course, a lot of upset people. We have about 15 to 20 that use it on a regular basis. participants. So I would say most of them, if not more, were actually at the meeting on Friday, got to hear schools, hear from DPR. The Langston Brown Advisory Committee is actually going to be still following up with some questions, maybe recommendations on how we might be able to work together. Maybe it could be before school hours, which becomes a DPR staffing issue because we don't have staff in there before. So we've got to see if maybe we could work that out, even though I know early morning hours is not going to work for everybody too, because everybody has different reasons why they've chosen Langston. But some people walk there and some people need to use it during that time when there's not a large public in the weight room. So I just wanted to share that. If you have questions, just know we did have that meeting on Friday. I think it was very important with schools and DPR, and it allowed people to ask questions. People still not happy, of course, and totally understand that. But we'll see if there's something also going to make sure that we can use it in the summer when schools isn't taking place. But unfortunately, that's going to affect us year round, that program. So that's just the update I had on that, unless anybody had any questions for me. Yes, Charlie.
So will there be any senior programs at Langston, or is it just one program we're eliminating?
Oh, yeah, no, I'm sorry. Good question. We are allowed to have programs on the first floor during the day. So we still have our Social 60 Plus Cafe, which we've actually seen since we've come back from COVID. That was always our smallest program. We're seeing that program grow, which is nice. And we have all of our other programs at our center director, but they just have to remain on the first floor. We can't have anything. We used to have programs in the gym too, like volleyball during the day. We've moved that stuff out too. So.
Jennifer, I have a quick question. Thank you for the update. Yes, Jim Richardson and I went over to engage with the folks at the Social 60 Cafe, and it's a great group. One thing they raised, and I know you've tried to resolve it and done well, is the transportation. How's that going? Any new developments on that? Getting the older adults with the van service to get them there?
I think that's actually done really well. We're almost a year into it now. We did finally get a permanent contract with Sunny's Transportation, and we've been very happy to have a shuttle bus. So it affects our programs across the board because now we're shifted. Like Arlington Mills, an early program, then it's Langston's in the middle, and then Walter Reed. But it seems to be working well. We've got most of our participants coming by the shuttle. It was bumps kind of getting the schedule because it's not like a school bus where it's going to pick up Miss Jones every day at 9 a.m. Well, on Tuesday, Miss Jones doesn't come for different reasons. So it shifts the schedule every day. So that's a challenge. It's probably harder for my staff than anything, working that out. But I think it's come a long way. We do have participants using the STAR program too, which has been very helpful especially if people might be lying farther out, not on the route of the shuttle. That helps because somebody being 20 minutes out, that could cost a lot of time during the day. So when we've been able to offer them the STAR option, and we give them the STAR coupons so they're not having to pay for it too.
Does anyone use Metro Access to get there?
No, not that I'm aware of, because Metro Access is it's harder because I believe you're given a window of time, so they could miss what they're coming to the center for because it's like a 2-hour window.
Okay. All right. Thank you very much, Jennifer. Yeah, great programs. We got to help people get there. So much appreciated. Thanks for the update.
Thank you.
Roland, did you have a question?
Yes. Hi, Jennifer. Jennifer, you may have mentioned this earlier in the presentation, but could you just describe a little bit what is the weight room, what equipment and everything is in the weight room?
It's just like you're almost like a gym. All right, well, it's got ellipticals, treadmills, weight rooms, single weight racks. So someone could want to go use to work out with would have option to. I know there were some questions, could we move a couple pieces of equipment downstairs? But that would really be difficult because then it would take up the limited programming space that we have too. And we've got a director there along with Social 60 Cafe offering a lot of great programs during the day also.
Well, you just answered. Thank you. What would have been my second question regarding that? But I do hope they can come to some sort of arrangement because physical fitness is very important for people as they age, and And 15 to 20 people is it's a pretty good number of people using that facility. So,
Yeah.
but thank you.
Yes, thanks, Roland. And it is a nice facility. It's, I would say, in fact, I go there myself. It is, the one at Lover Run is probably the state of the art, but the Langston is great. The one at 4 Mile Run, I'm not sure. I haven't been there in a long time, but that's there. Madison is good, but it's a little smaller and the machines are a little older. So yeah, and the thing with Langston is after school, you have a lot of high school students that use it. So that's the juggling between older adults and other users.
Any other questions or comments for Jennifer?
Thank
All
you,
right.
everybody. Happy New Year.
Thanks, Jennifer, for joining
Happy
us.
holidays.
Appreciate it.
Thanks, Jennifer.
All right, so next up we have Candace Lopez, who is the Project Peace Coordinator for Arlington, Virginia, and she's here to give us an update on some of their activities. Candace?
Thank you, Helen. Good morning, everyone. My name is Candace Lopez. I'm the coordinator with Project Peace, which is Arlington's coordinated community response to intimate partner and sexual violence. For those of you who don't know us, PEACE is an acronym. It stands for Partnering to End Abuse in the Community for Everyone. And what we do is we really bring together all the different agencies that would either work to prevent or respond to intimate partner and sexual violence in Arlington. And we do that through different work committees. So we have 3 committees, one that works on prevention, which is working with the schools and youth serving organizations to ensure that young people have the information they need to start out having healthy and safe relationships. We have a work group 2 that really focuses on that crisis response. What happens when somebody calls the police, shows up at the hospital, right, calls a hotline. And then we have a 3rd work group that focuses on after violence. After violence has occurred, what are things folks might need if they're staying in the relationship, if they're leaving the relationship, if they have children, if other people witness the violence. So we come together monthly in those 3 different work groups from folks across the county, public and private partnership, similar to a commission, but we're not a formal commission. One of the things that we've been working on recently through our prevention lens is really wanting to look at how men and boys are experiencing the world around us here in Arlington. So we have actually launched a needs assessment to understand the experiences of men and boys with the rising conversations on the state of men and boys and clear data that shows us ways in which we're failing boys and ways in which they're falling behind. We really want to understand what's happening to young folks here in Arlington. So under our committee, Arlington Transforming Masculinity, we've launched a needs assessment where we're doing surveys and focus groups all across Arlington to really hopefully get a good sense of what's going on for folks in our community and how they're experiencing specifically these concepts and ideas around masculinity. And so we've been working with Helen and with Rachel to identify some places where we can do these surveys and focus groups with older adults. We want to ensure that we really do have the full ranges of experiences here in Arlington. And so I've put the survey in the chat just so you all have it now. We encourage anyone to take it who's interested, but also so you can get a sense of the kinds of questions we're asking. The survey only takes about 6 to 7 minutes, and we're offering it in English, Spanish, Amharic, and Mongolian. And then our focus groups, we're doing in English and Spanish. And again, we're trying to do that with all different age groups and all different across the gender spectrum. And so we're looking specifically at doing a couple with the social 60+ cafes first. We're going to do some maybe like some tabling with some support in helping people go through the surveys, and then offering like maybe a focus group for folks who want to stick around and be a part of a much larger conversation. And then depending on how those go, we're going to look at some of the independent living centers as well. But we wanted to come here just to let you know what we're doing and how we're trying to engage with older adults to hear about their experiences, and specifically with the emphasis on, really enhancing supports and services for men and boys here in the community. I'll stop there just to see if anybody has questions, comments.
I have a quick comment. Thank you so much, Candace, for this. In fact, I remember doing a presentation on Domestic Violence Awareness Month in October. So yes, there are always members of at a senior center, and there are always members of the audience who, you don't want to ask them if they've been involved, et cetera, but do they know anyone? And they, there's somebody who does, will raise their hand, and they want a point of contact on how they can get the person to get help. So appreciate you doing that, and going to the social 60s is a great idea.
Well, and to your point, William, sometimes folks don't want to engage with us around the topic, but they'll engage with us around other topics. And so, starting the conversation here around masculinity and healthy relationships, opens up that opportunity. I am going to put in the chat a new resource we just put together called No Wrong Door. This is a guide of all the services in Arlington that is just really helpful if you or someone is navigating supports, whether they're staying in a relationship or leaving a relationship. Sorry, Carlos.
No, go ahead, Candace. You're also doing a flyer specifically targeted to older adults as well, correct?
Oh, yes.
Yes.
Thank you. Yeah. We're building a brochure specifically for older adults with the resources here in Arlington. Yes. Thanks, Helen.
So as soon as that's available, we'll be sure to send that out to you. Carlos, go ahead.
I just wanted to say thank you for sharing the information. As someone who's worked around sexual violence against women, specifically in the Latino community, it's so important to have resources that are introduced early to unpack the challenges of what it means to be Latino, and cultural constructs like machismo can create not only barriers, but sometimes opportunities to understand how machismo as an asset as well for Latinos. But it's a difficult issue to navigate. And I can tell you, I actually provided counseling services many years ago to men who were found guilty of sexual assault and violence against women. And not once in all the interviews I did, and this is at least 4 years, did a Latino man ever say, yes, I did harm. He would say, I pushed someone, or I pulled her hair. That's not violent. So there's a need for this. So thank you.
Thank you.
Adele?
Thank you. Hi, Candace. Thank you again for sharing that information. Just wanted to know if you had any particularly state legislative fixes that you are supporting in the upcoming session, and if not, if you have any state legislative ideas to support your work.
Yeah, I know we've really been interested in the inclusion of coercive control into the definition of intimate partner violence. We know other states have done it. We know Virginia's thinking about it. So I'm not as connected to knowing kind of where it is in the pipeline, but I know that it's been a conversation folks have been having, and I think they were thinking about it in this next session, if not the one after. But we know that would really broaden the definition of what is considered domestic violence. Right now it really is just physical violence, and it has to be to a certain extent. And so really broadening that definition would allow more access to services, more validation of experiences, also when people call out and seek help and support. One of the things we're really focusing on is making sure that people know there's a resource no matter what's happening, because sometimes people might call the police, but it doesn't rise to the level of like police intervention, but that doesn't mean that violence isn't happening or that people don't, need the resources and supports. And so really ensuring that we're talking holistically about what violence looks like. And I think, including that as a part of the definition would really allow for that.
Yeah, I guess someone who you mentioned that you might not be connected in terms of where it is in the pipeline.
Yeah.
Possible for you to connect that person with me as we go into the legislative session. That way I can look out for whatever legislation may be on the table. And if there isn't legislation on the table, what could be done now versus in the next session.
Yeah, I'll definitely find out where it is and what the connection and connect you. Thank you for your interest.
Yeah, of course.
Hey, Linda.
Hi there. I had a quick question. Could you tell us some of the nonprofit partners you're working with, Candace?
Yeah, and so part of our collaborative, we have obviously Doorways. They're the primary provider of domestic and sexual violence services here in Arlington, and the county supports them pretty substantially in that effort. SCAN of Northern Virginia, Legal Services of Northern Virginia, Just Neighbors, some of our culturally specific partners like Lantandohio, they work with the Mongolian community, Ashiana works with South Asian and immigrant communities, DVRP, ECDC. I think that's all of them. Yeah.
Thank you.
Oh, the Women's Center, sorry, also, and Northern Virginia Family Services. It's quite a list.
Any other questions or comments for Candace? And I will include a link to the survey, as well as we'll send the brochure that's targeted specifically to older adults out as soon as we have it. So
Thank you. I put my
If nothing else.
email
Thanks,
as well,
Candy.
just because if you're ever having trouble connecting someone to services, I'm always a resource. So please, keep my number or my email address if you need it. Thanks, everyone.
Thanks, Candace, for joining us today. Appreciate it.
All right. So Helen, is the next step the approval of the minutes?
Yeah, so the next step, we have to approve the October minutes. If you remember, we sent those back for a revision. They have been revised and sent back out again, so those need to be approved, and then the November meeting minutes after that.
All right. I hope everyone had a chance to review the October minutes. Do we have a motion to approve?
I'll make the
So
motion.
moved.
I'll second.
Great. All right. All in favor, please say aye.
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 Any opposed?
Aye.
Any opposed? With respect to November, do we have a motion to approve or any questions on the November? Let's start with that.
So moved.
Okay, we have a motion, a second.
Second.
All right, all in favor, please say aye.
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 Any opposed? Okay, seeing none, November is approved. All right, next up is the chair's report and executive committee. So I want to get to the committees quickly. So just to say that we have a lot of great momentum going, did a lot of work during the executive committee, working on refining our age-friendly plan. We also engaged with state legislative leaders like Adele and her colleagues, including Delegate Irene Shin, Delegate Dan Helmer, and so Adele and your colleagues, we really appreciate all your support, including your support today with the domestic violence, intimate partner violence issues. And also, of course, working with the county board members. So let me see if I missed anything else on my list here. Working on the community engagement forum, had a great meeting. So we invite members of the public to be involved with that as well. And our recruiting committee is doing great work. We have 2 applicants, I'm sorry, 3, and we're interviewing 2, and we're working on the 3rd one next. So thank you everyone for your hard work. Helen, did I miss anything?
I don't think so. I would like to welcome Michael Bouchard, Catalina Kalachan, and Kasha Shaw. They are attending the meeting today. Those are the 3 applicants that we are currently in conversation with. And so welcome to the Commission on Aging meeting. We're glad you're able to join us today.
Yes, thank you all. We really appreciate your interest and continuing the tradition of the hard work and dedication that the members put out. So really appreciate it. So next step, staff reports, AAA, Helen?
Good morning, everyone. I am on my own today. Both Rachel and Maimuna were unable to attend the meeting today. So updates should be relatively quick. So first of all, big congratulations to the VICAP team under Michelle Thomas's leadership, and both Charlie and Mike Schuster are volunteers for this program. So we're well represented in the meeting. They wrapped up another successful open enrollment period on December 7th. And a couple preliminary numbers that Michelle has provided to me. They held 6 events in the community this year. And 3 of them were at locations that we haven't traditionally visited before. And so Michelle is doing a really nice job making sure that we're representing reaching out to all areas of Arlington, not just the ones that we usually do. So throughout the 7-week period that is open enrollment, the team provided counseling to 285 beneficiaries, and they saved our beneficiaries about $65,000 in cost savings, which you know, we've had higher numbers in previous years, and that number fluctuates every year based on availability of patient assistance plans, the number of people that come seeking extra health programs, and whether through the assessment it looks like changing plans would actually help to save somebody money or not, right? So that number really fluctuates every year, but I think $65,000 in cost savings is significant. And so just a big congratulations to Michelle, Charlie, Michael, and the rest of the VICAP team. So thank you for all the hard work that you do. My second big announcement is we have named the developmental supervisor for the ADRC. I'm very happy to announce that Tanae Young, who has been the team lead for the ADRC, was selected to serve in this developmental position. She started on December 4th and is already off and running. And so we're just really happy to have her as part of our team and her leadership with the ADRC, especially as they are continuing to see increases in the requests. The number of requests for financial assistance and for shelter still continues to be on the rise. So congratulations to Tanae. We are still in the recruitment process for our AAA nutritionist, and that position will be reposted again this week on Friday morning, and hopefully we will get a good solid pool of candidates, or at least one good solid candidate that that we can consider. Let's see. William already mentioned the Community Engagement Forum. Again, just a reminder that that is on March the 18th, Monday, March the 18th. The actual programming we're planning is from 10 to 12, but we will have like a resource fair and the usual continental breakfast that we offer. We'll start around 9:30, and then we'll have that also available from 12 to 12:30. So if people want to hang around and again, look at for resources and that type of thing. And just a reminder too, that we'll be focusing the programming on the age-friendly plan. And so, you know, taking the work that you've done and validating that with the community that we're on the right path for our next 5-year plan for age-friendly. Let's see. The Adult Day program held a successful Caring for Caregivers Day, I think 2 weeks ago. Hearing just really rave reviews, and we're getting some feedback even from the community about how wonderful a day it was for the caregivers. And so, you know, I'm sure that they are looking at incorporating that again. They are also planning to hold Caring for You, Caring for Me sessions starting in January. And this is a program that actually comes out of the Rosalind Carter Foundation. We purchased it a couple years ago, so really excited to see, you know, this. We're starting to be able to offer these sessions now to our caregivers to provide that support. From the kind of V4A level, V4A is the Virginia Association of Area Agencies on Aging. And this is the board that is comprised of each of 24 of the 25 AAAs from Virginia are participants in V4A. And so they were instrumental in getting the additional $700,000 added to the budget for this year for AAA services. They are currently working with Leah Mills, who is I think she's Deputy Secretary for Health and Human Services at the state level. They are working with her on what the ask for the governor's biennial budget should be. And we're looking at an ask of about $5 million of additional funding for aging services. So I'm sure that there will be opportunities for advocacy coming up very soon. And so we will be letting you all know. But that is in the works. And then the other comments that I have relate to just really quickly the coordinating of speakers for these meetings. I know William has sent out a request to all the committee chairs with an assignment per month for each of the committees. If you are looking to arrange a speaker for the Commission on Aging, please have that confirmed and the name to me by the first week of the month. If the meeting is on the third Monday, if it falls on the fourth Monday, that can be the second week. But we need to send the agenda out a week before the meeting. And so really need to have that information ahead of time. So we're not scrambling to figure out what to put on the agenda. And then we've also implemented an online submission of reports for both the committees and the liaisons. A little bit of a rocky start, I think, this month. I think I received three, maybe 4 reports ahead of time. So I will include the link to the form every time I send out the meeting reminder. If you can have them submitted a week ahead of time, then I'll compile them and they'll be sent with the Friday reminder that comes out a couple days before the meeting so that you have it ahead of the meeting. So, and then a final note. So many of you who come into our offices have met Franchetta on the 4th floor. She sits at the front desk and greets all of the clients and visitors that come to ADSD. Franchetta is retiring. Friday is her last day. It is very bittersweet for us here in ADSD. Franchetta has been part of our family for 18, 19, 20 years. Michelle, do you know? It's been quite a while. And and the clients all are really, she touches everybody in a very unique way and makes everybody who comes into our office feel special. So not only staff, but our clients will feel her loss. We wish her well in her retirement, but are very sad to see her go. So that is all the updates that I have from ADSD this morning. Any questions for me?
Helen, I know you mentioned Rachel's not in the meeting. Any comments from Maimuna?
So no, I checked with Maimuna this morning and she didn't have any additional updates on top of what we have here.
Okay, thank you very much.
Mm-hmm.
Any other questions or comments from members of the
Kathy?
public, anyone else?
Yeah, I know we've talked about the addition of the 700,000 in the state budget previously. Have you received any word about how much additional Arlington County specifically will receive out of that 700,000 and where you plan to allocate it?
Yeah, no, I actually haven't seen anything on that yet, Kathy. So hopefully we'll hear something soon. We're finally getting feedback from the state on our area plan submission that we sent back in July. So, okay. So hopefully that's coming right behind this.
Great. Okay.
And so I think we announced last time, but I'll mention it again. There is a new deputy commissioner for aging services in DARS, Kirsten Ware. She is now on board. Rachel and I had a good conversation with her beginning of last week. And so really looking forward to meeting her. She is planning to come to Arlington in sometime after the January V4A meeting. She's going to be scheduling her tour of the different AAAs. And so we'll look forward to meeting with her sometime soon, early in the year. And we'll be sure to, notify the commission when she's coming. Probably we'll have a session if we can pull it off, that includes the commissioners as well.
That'd be great. Thanks.
All right, unless there's anything else, I'm going to transition to the age-friendly reports from each of the committees and throw the floor open to them. But just want to note that the committees have been doing a lot of great work, and we've discussed in the executive committee, brainstorming, refining the goals and how to get there. And also taking into account, the future changes coming, let's say in the next 25 years. When we met with Libby, she mentioned that she's also convening a group when she takes over as the next county board chair on things that are going to change in Arlington. And so, I'm going to just go in the order that we typically go in: housing, transportation, healthcare, long-term care, in our communication legislative committees. And to the extent that you want to put out information, any highlights, please do so. So Audrey, if you're ready, the floor is yours.
All right, I'm unmuted.
Okay, great.
Sorry. Can you explain a little bit more about what level of depth you want and what you're looking for?
I would say just enough, for example, any changes. For example, if you want to talk about the meeting with Libby, and so that members of the public or our applicants know what the highlights are, just a high level.
Okay, well, our goals fall into 3 categories, and they are advocating for affordable housing and support for existing affordable housing. The second goal is to promote supportive services that help keep Arlingtonians safe in their homes, living independently as long as possible. And that includes things like universal design, putting resources together and promoting those resources so that Arlingtonians in condos and homes where they have the ability to make changes can put in things like grab bars, switch out bathtubs to showers, lighting, lots of issues like that. There's a lot of resources. We just need to get the word out. It's also working with developers to try to do what we call universal design, which is to put in features into new buildings or buildings being renovated so that everyone can be safer. And they include things like grab bars and better lighting, under counter lighting, floor lighting. And then the third goal is to promote the development of affordable assisted living, which has been a challenge here because we have neither carrots nor sticks to get developers to commit something that has a high cost and an undefinable cost. The unit is one thing, which is what affordable housing requires. But in affordable assisted living, you've also got the daily care and food that can vary and is significantly more expensive than the unit itself. And Barbara Favola and others in Richmond are looking to provide some ability for Arlington and other counties to require a minimum number of affordable assisted living units in new assisted living developments, which would give us the ability to really maybe increase the number. Right now we have some at Carlin Springs, but the need far surpasses the availability. We have something like, I think, 60 people on the waiting list at Carlin Springs, if I'm right. And Libby, when we met with her, was very supportive of this, but again, her hands are tied. She was overall, we had a very good meeting, and I encourage others to meet with her when you've got something substantial. But we are asking her to do things like to vote for any new developments that have affordable housing components and to help push more affordable housing units instead of just the contributions. So we have a bunch of goals. I think the Transportation Committee is looking into parking at affordable housing units. And I have asked the PIO committee if they can help us promote to homeowners, communicate with homeowners on the supportive services aspect. So that's where I am.
Thank you, Audrey. Does anyone have questions or comments for Audrey? Looks like Carlos has a hand up. Carlos, please go ahead.
Hello. Hopefully everyone can hear me. So
yes.
I just have a comment. I did receive a request for the public information and outreach committee to support efforts on other committees. And so I don't want to get a point where suddenly we get a lot of requests and have to say no to things. So is there a way that we can sort of navigate through that or sort of or coordinate that so it doesn't become overwhelming for any one committee?
Well, I think the amount for, at least for housing, that we were going to do would be, you know, in a few month period, at some point, a couple months of communicating with homeowners. I don't know anything. Maybe that's training us on how to do it, but I have no understanding of how to reach older adults. But it's certainly not going to be a 5-year or 4-year project. It's going to be very episodic and very focused. So I hope that helps you feel better.
Yes.
Yeah, so let me weigh in on that. So Carlos, yes, please feel free to reach out if I can be of assistance in triaging or prioritizing. And so thank you for raising that issue.
Thanks.
All right, who do we have next? Number 2, I believe that was, yes. All right, Linda, please.
You're still muted.
You're muted.
Sorry. Yeah, sorry about that. I just had a quick comment for you, Audrey. For what it's worth, the Episcopal Diocese of Virginia passed a resolution encouraging that they will be lobbying at the state level to empower local jurisdictions to change the special zoning requirement now held by church properties, so that they don't have to go through the lengthy approval process to repurpose and dedicate to build affordable housing. I don't know that it'll go anywhere, but at least that is a goal that they have, and that they will be working in Richmond to acquaint the delegates and senators about. So just so you know.
That would
Linda,
be fabulous.
just to follow up on that. So that is something that folks are putting in to reflect the what happened in California, which is also known as Yes in God's Backyard, YIGB. And the YIMBs, they had asked me to put that in for drafting, and it looks like Delegate Betsy Carr, a senior member of the General Assembly, will carry that.
Thank you.
Mm-hmm.
Exciting. All right, so I see, Carlos, your hand is still up. Do you have a further question, or otherwise we have Kathy next? Okay, Carlos has hand down. Kathy, please.
Yeah, so I was just curious, and maybe Linda, you know, or others who have worked with NVAN, what activities have taken place or could take place around the use of Medicaid waivers for affordable assisted living for that population? Is that being also looked at, Audrey, or is that off the table because it's been explored previously and it went nowhere? That's kind of what I've heard in the past. So I just wondered, I know that's a sort of a state issue, but any insights on that?
I'm going to defer to Erica or Linda.
Erica. I think Erica may have some answers
Erica's
more than
hands up.
I.
Erica, do you want to respond to that?
Yeah, so the Joint Commission on Healthcare did a study. I guess it's been a couple of years already, looking at affordable assisted living, and they looked at the auxiliary grant and the need to raise the auxiliary grant. But they also looked at the possibility of using Medicaid funds for assisted living here in Virginia. You know, a lot of other states use Medicaid for assisted living. They don't even think about it.
Exactly.
But to us, it's a big deal, and it would be a big change. The Joint Commission report reflected that. I think that when it came to the vote, the Joint Commission didn't actually vote for that, and it never went anywhere. A smaller issue connected with that is at least to raise the personal needs allowance for those on Medicaid waivers, and that's something that's at least in the Commonwealth Council platform. But no, I think, you know, this is there's a real need for advocacy, not just this year, but in coming years, to look at the use of Medicaid in assisted living.
Mm-hmm.
Erica, myself and Senator Favola are planning to put in a budget amendment raising the personal needs allowance.
Wonderful. Thank you.
Thank you, Adele. Thank you for all your support in helping older adults in Arlington. It's great to have you and have your support and your staff support. Great, thank you very much.
Absolutely.
Anyone else regarding housing? And thanks, Kathy, for raising that issue. All right, transportation. Jim, would you like to give an update?
Sure. I think you all have our report that we sent in for the November-December month. And I would ask any of our members if they have anything that in that report that they want to emphasize or anything beyond the report. Joan?
Well, I really don't have anything to add, but at the November Transportation Commission meeting, most of the time was spent on talking about the zero bus emission study that has, well, it's being done, and that would affect the ART buses, that way in the future, the buses would be operated not polluting the air like they currently do. And 2028 would not show the acceptance of that, but would be a date for showing what they have really come up with. So this is nothing that has gone to the county board yet, but it's a big study. So that's all I'll say.
You bet, and a really big issue. Jim Feaster, do you have anything more on pedestrian or bike?
Nope.
Okay. Wendy, Emily, anything on rides? Okay, well, let me turn to the new. We have one new event coming up, and from William's interest, I reached Brenna Helfer. Dr. Helfer is the WMATA representative on the county staff, and asked her if it would be possible during our next next quarterly, if we could get together with WMATA's Metro Access manager to talk about Metro Access and some of the problems that we seem to be having with late arrivals, et cetera. She did this. She and the Christian Blake, who is the manager, will be at our quarterly meeting. So I guess I need to set up our quarterly meeting, and that would be Helen on the 13th of February at 2 o'clock. If you could get me a location for that, I will call Brenna and let her know. Also, she asked if we would invite the Disability Advisory Committee, which I think is a great idea, because during that meeting, we will also be talking about the sidewalk condition problems and also the audible signal. Jim Feaster and I are going to be meeting with Nate Graham in the next couple of weeks, and so we should have some pretty good information on that. She also asked us to invite CSB, and I'd be really happy to do that, but I don't know who they are. Helen, can you tell me who CSB is?
I can look into that for you, Jim, and get you a contact.
Okay, and you'll get me a contact on the disability too?
I can try, yes.
Okay, super. The last thing I have is that our speaker for our April meeting will be Wendy Zenker and Emily Braley, who will be talking about the volunteer rides and what we can do to help them. And I think that is all I have.
All right, thank you, Jim. Do we have any questions or comments for Jim? So Jim, thank you very much. I think Americans want to get from point A to point B fast and with frequent service. I was reading a history article over the weekend in my free time, and they noted that. And this was from 120 years ago. So, this has been going on for a long time. And they were noting how in New York, there were elevated trains above the street, there were streetcars on the street, and there were subways underneath. And so think what they've done, think what they had 120 years ago, and we want to have, good services today as well. And, that helps people who have affordable housing but live farther away to get into Arlington and support our older adults, and as well as older adults that move around. So thanks for reaching out to Metro as well. Metro Access, as you and I found in our outreach, people had concerns about applying for Metro Access and also the on-time arrivals. So it's great that Metro Access will be here and we can get their updates on current operations and what they see in the future. As we all saw with the budget cuts, they're gonna, I hope I'm quoting this correctly, but there are some potential cuts to Metro Access that'll impact older adults and disabled folks. So
yeah, I might
go ahead, Jim.
I might inject that as far as that getting to places quickly, the problem has always been that the only way you do that is if you drive your car. At least that's what everybody thinks. But transit is coming along, and the county, because of the transit strategic plans, has pledged to redouble their efforts to decrease the amount of time between ARC buses. So that's going to be another really big deal. Of course, they've got a 10-year block to do that in, but that's really important. So thank you.
Thanks, Jim. Yes, frequency, very important. Anyone else have questions or comments on transportation? Okay, I'm going to move on to the healthcare committee. Would you like to comment on your age-friendly plans, healthcare?
I can get us started. Oh, go ahead, Linda.
Oh, good. Thank you. No, Kathy, I was going to ask if you wanted to do
Sure.
that. Go ahead.
Great. Thanks, Linda. So Linda, Kate, and I met since the last Commission on Aging meeting to draft some goals and objectives relative to what we're calling the area of need is improving health and wellness, which, definitely, as we talked about at the last meeting, is a broad area that we think needs to be included now in the new age-friendly plan. So there were a number of goals that we talked about, one being supporting senior adult mental health, making sure people are aware of mental health services, making meaningful connections through increased access to programs, particularly those that reduce social isolation and loneliness, increasing outreach to vulnerable audiences, and we feel the need to work really closely with, I guess it's the equity committee now, is we're calling it, Carlos's committee that he's leading. So that's one area, mental health. And I think we're discussing bringing a speaker to the January meeting to talk about mental health. So that can kind of maybe help us hone in a little bit more on the objectives under mental health. So goal 2, coordinate and increase outreach of available programs, definitely in partnership with the Senior Ambassador Program and other social outreach options. We've talked about looking at, things like the Arlington Free Clinic, the Virginia Health Clinic, evidence-based programs that are being offered locally through the Older Americans Act, making sure people know about them, identifying dental resources available to low-income older adults. And in fact, when we met with Michael Bouchard last week, he mentioned a dental resource that I wasn't aware of. Maybe Linda, you're aware of it through, I think it was Northern Virginia Community College.
Yes, that's right.
Yeah, yeah. Where the students in that program and the professors provide free dental hygiene services for low-income individuals.
It's just not convenient in terms of location.
Yeah, people have to get there. Yeah, yeah. That's what I figured. Yeah. So that's an area, dental, we definitely thought was really key. So another area is increasing coordination of care. I think, Kate, that was an area that came out of the Virginia Health survey, or needs assessment.
Community health needs assessment. Mm-hmm.
Yeah, yeah. So that would be better coordination of care for people being discharged from the hospital to home, making sure that they have access to appropriate services to meet their needs. So, and I think, Helen, you probably can explain what actually happens at the community level. So just figuring out where the gaps are in that area, I think, is something we want to look at. Yeah, so it would be around discharge coordination. Let's see. And then we've talked about the age-friendly health systems approach, which is actually separate from age-friendly communities, but it's an effort to really advance health systems to become more responsive to the needs of older adults while they're in acute care settings. And there's lots of resources, including training and education for staff, models that can be developed and implemented in health systems. So that's an area too that we wanted to explore and felt it was an important part of us moving forward. And then finally, looking at advocacy opportunities at the state and local level regarding health and wellness for older adults. So maybe coordinating again with other committees on that. Linda or Kate, anything you want to add to that? We have a lot.
I don't think we can add.
Well, I mean, add in terms of
Yeah, I'm kidding.
more detail on what I've shared. Yeah.
You did a great job.
Yeah, thank you, Kathy, for covering that. I think the only thing I would add is that our group is the first group to provide a speaker to brief the commission in January. And I don't know if anyone has any particular interests that follow our goals as we've illustrated them that can provide guidance. Kathy, you mentioned some interest in going for someone who might provide some mental health education among older adults and what the issues are there. But if any one of you as commissioners from your experience, if you have any advice, you can certainly provide it, and we'll take that into consideration as we get together and figure out who can come and speak to our group in January. We've got some hands raised.
Yeah, we do. So Helen, can you see who's first, etc.? I thought I saw Charlie.
Yeah, Charlie, then Joan, then Audrey.
Yeah, but first I just want to thank the Healthcare Committee for your expertise and energy, and this is an area we need emphasis, and so thank you for doing that. Exciting plans. Okay, Charlie, please.
Sure. We've had a subgroup of our long-term care residents committee looking at the age-friendly plan in terms of nursing home care. And it hasn't been decided where this would fit, but it's most closely allied to health, so I thought I would mention it now. And I did mention this at the last meeting. We were supposed to review our draft last Thursday at our long-term care residences committee, but time became too short to get into that. But just to remind you, there were in our draft, there are 3 goals with respect to nursing home care. And the reason we think a special focus on nursing home care is needed is, as you know, we have 3 freestanding nursing homes in Arlington, and they've all been just about chronically rated at 1 or 2 stars by the 5-star Medicare CMS rating system. and nursing homes generally have served the people who are in nursing homes for the long term. Most end up on Medicaid, so it's a very high Medicaid population. So poor care is also an equity issue, I think, in nursing home care. So our nursing homes right now and for a long time have not been age friendly. So I'll just mention the three goals that I mentioned last time. I won't go into objectives, but goal one was to support environmental design quality of Arlington nursing homes. And that is because they are all large hospital-like institutions, which are now shown not to be beneficial to people's care and welfare. Goal two is to support greater community integration of nursing home residents with the community. And goal three is to increase transparency of information about nursing homes. As you can't avoid from reading the papers, nursing home ownership and operation is a shell game that nobody can really figure out. And we think that besides the federal and state government looking at this, our county needs to figure out ways to get greater transparency also. So more to come on that, but I just want to mention that since it's related to health.
Thank you, Charlie. Yes, very important. And in fact, you gave the long-term care briefing, I think, so much appreciated. And yeah, so and I did see an article in the New York Times this weekend about, and I'm sure you saw it as well, a Colorado nursing home, and illustrating the private equity ownership that they want to cut costs, so they had nobody there, or the person who was there was watching TV while a resident walked outside in the freezing cold and couldn't get back in and died due to the cold.
That was in the Washington Post.
Right.
Oh, the Post. All right.
Yes.
Thank you. Thanks for checking my citation. And okay, so thank you, Charlie. So who's the next person? They had a question about healthcare?
I am.
Okay.
And
Joan, go ahead.
actually, it was that article that I wanted to call to everyone's attention, but it focused on assisted living facilities and the way that some of the, especially memory care residents, are not watched carefully enough. They get outside, they disappear, and then a number of them die. So I think this is something that the Health Committee should take a look at. Of course, it has to do with staffing. That's the big word for everything, really. But if you didn't see that article in the Post yesterday, it was a powerful article. And especially for the memory care residents in assisted living. So that's all I wanted to say.
Thank you, John. All right, who do we have next?
Audrey's next. Oh, wait, it's Kathy, you want to add?
Yeah, I just had a question for Charlie around the second goal related to greater integration. Can you say a little bit more about that and how maybe we might work together on the Health Committee on that specifically?
Well,
community integration, yeah.
I mean, one of the things that we notice is that the local communities don't have a lot of involvement with nursing homes. And part of that is from a governmental level is that everybody sees nursing homes as controlled by the feds and by the state, and local governments don't have any control over it. But there can be a great benefit by making the community more involved and more aware of what goes on in nursing homes to create that community-based momentum to demand change. And so our objective one under that, as it's drafted right now, and of course all of these could change or expand or contract. Objective one is to establish community advisory councils to bridge facilities and community, and to establish a nursing home engagement outreach worker in the county to support the creation and operation of community advisory councils. Some on this committee have had a lot of experience with community advisory councils. they're very hard to make happen and to keep going when you're relying on volunteers and individuals to do all the footwork that is needed. And we think that, and this could be for assisted living too, but we think that in the long run, you need a paid coordinator to make that happen. That's why I'm just there.
Thank you.
Ellen, could you
Audrey?
take care of it next? Yeah.
Just a small point. When you mentioned mental health, one of the goals or one of the objectives we have is to work with the county on evictions. And a lot of the people in the county who are evicted have mental health issues. And I'm not sure if there's a way to work together, but I just wanted to let you know that that's on our radar. Thank you.
Next up is Erica.
Yeah, I also had a comment on mental health. And Kathy, when you were talking about having a mental health speaker in January, and also the discussion about working with the CSBs, Ann Herman of the CSB is the person from the CSB who's been sort of designated as a liaison to the older adult community and to the Commission on Aging. And I think many of you know Ann Herman, and she might be aware of mental health speakers. One in particular, I'm on the Mary Marshall Community Advisory Council with Ann, and we had a wonderful speaker, Dr. Lebanon, who runs support groups at Mary Marshall. Now, admittedly, that's a special population, but I think he's a neuropsychologist, but he seemed very knowledgeable. So if you want that information, I can send it to you.
Yeah, that would be great. Thank you.
Okay.
Yes, please do.
Yes.
Do we have any more questions or comments for healthcare or long-term care? So thank you all for your dedication and energy to that. And I think we're fortunate to be able to review and regroup and rethink regarding our goals and shape the age-friendly program. I hear somebody.
I think it's Claire Jacobson. Claire, did you have a comment you wanted to make? Claire, you are muted if you wanted to comment. You will need to unmute yourself.
Can you hear me?
Yes, we can hear you now. Thank you.
Hi, thank you for allowing me to make a quick comment, and I'll have one later on. But back to Charlie and our focus on nursing homes and the fact that most of them are, I guess, probably close to 98% probably are Medicaid, receive Medicaid assignments or whatever. But also we need to remember in terms of advocacy, so many of the nursing home residents, Cherrydale or the other two, Regency and the other one, I can't remember, Carlin Springs something, the name changes just about every day, that a lot of them don't have, if they have family members, the family members don't visit a lot, are not very active participants, and many don't have family members or don't have a personal advocate. So that's another thing we need to keep in mind. I don't know whether if we ever get some of the advisory councils at Cherrydale relaunched or the other two, but that's something we need to keep in mind. It's that so many don't have family members or a personal advocate. So we also need to be their advocates somehow, some way, because obviously we're not family members, we don't have standing, but it's really a big issue. So many don't have an advocate. Thank you.
William, you're muted if you're speaking.
All right, thank you. Hearing none, I'm going to move on to the Aging and Equity committee and then the legislative. So Carlos, floor is yours.
He did put in the chat that he may have to go offline.
Okay.
And that
Is
he-
Anthony available?
I am. Yes.
Anthony, how are you doing?
I'm
Please,
good.
the floor is yours.
Sure. So in December, we just completed our final meeting with one of the delegates. In November, we had our meetings in person as NVAN volunteers with Senator Vola and the other delegates here in Arlington. We completed that last meeting with Herschel, Roland, and I this month. And so that's really the only update we're looking at, what we're going to be doing for the month of January in terms of as the General Assembly meets, and just really tracking the 6 NVAN priority items as they start to roll through the process. So that's all we have from the Legislative Committee side.
Thank you, Anthony. Any questions or comments for Anthony?
Well, I would just like to add that the dates are the General Assembly convenes on January 10th, and they will end sine die on March 9th. It's the long session, so it's a brand new budget that the General Assembly will be working on.
Great, thank you very much. Yeah, we're lucky to have Delegate Del McClure as a member of the commission, and she's so energetic and supportive of our mission. And of course, for the we mentioned NVAN a number of times, so we encourage everyone to get involved. That's the Northern Virginia Aging Network, which is a coalition of the 5 Northern Virginia area agencies on aging and the commissions that are related to them. And so, as Anthony noted, we've been working on the 6 priorities. If you Google, for the members who are not members, but the members of the public who may not be familiar with it, if you Google Northern Virginia Aging Network, it's online, and it's 6 priorities are there, most of which focus on housing, including extending the grace period for evictions, and as I believe Charlie noted, supporting assisted living for, maybe somebody else mentioned this, but supporting assisted living for low-income individuals in terms of setting aside spaces, as well as increasing the subsidies, preventing fraud and scams via training for conservators, as well as expanding the use of electronic meetings like this, so that we can meet, and older adults and others who can't get to in-person meetings can serve in leadership positions. So invite you to familiarize yourself with the NVAN agenda and get involved. And that's, I know the commissioners are very well aware, but want to encourage members of the public to do that as well. And with that, do we have any other comments on age-friendly Arlington work session or questions? Helen, anything before we transition over to old business, new business announcements?
Nope, I don't think so.
All right, any old business? I thought I heard something, but apparently not. Any new business anyone would like to raise? Hearing none. And any announcements, Helen?
I do have one announcement about the steering committee. This is a group that has been in existence for quite some time. And it is intended to be, so it's the long title, I believe, is Arlington's Steering Committee for Services to Older Persons, or something like that, right?
Yes.
But we've been talking a lot about, having an opportunity for the business community to be involved, as well as collaborations among service providers. And so there is an effort underway now to sort of look at the steering committee and kind of revitalize it. So you will notice on the calendar of event that I sent out on Friday that the January meeting has been taken off the calendar. There is a small group that will get together to do some brainstorming on how we can revitalize that. And then we will look to have a more inclusive discussion at the March meeting. So more to come on that, but just wanted to make that general announcement.
Do we have any other announcements? Thank you, Ellen. Any other announcements? All right, I have an announcement. Thank you all for your energy and participation and dedication, and I wish you happy holidays and I look forward to working with you in the new year. So thank you very much. Unless there's anything else, we're gonna adjourn. Helen, anything else?
No, I don't think so. You, Kathy, and I are staying on, yes?
Yes.
Okay, okay. Happy holidays, everyone. Thanks for joining.
Thanks, everyone.
Happy holidays. Yes.
Take care. Ellen, it looks like.
Oh, hold on just one second. Let's let the
looks like
room
there's still
clear.
more. Yeah.
I think I
I
can.
still see callers on the far right. Do we want
Yeah,
to?
I can kick them out, I think.
Okay.
That's kind of mean, but
Yeah, Carlos, yeah, he didn't give her his report, but
he put something in the chat that said it was
Oh,
his.
yeah.
Yeah. Here.
Oh, great.
Bless you.
Yes, bless you.
All right, so now it's just the three of us. Okay.
Oh, okay. There's still a caller. Is that?
Oh, really? No, I'm
Yeah.
not.
A 7.
Yes, some
There was
777.
There was only one caller. I'm only showing 3 people in the room.
I'm seeing one on the far right.
Interesting.
Yeah, under people, it does say there's another number.
That's odd. Is
Any of us calling in by phone?
The only one that called in was Claire, and I don't think she's there. 525. She's 703-525. No.
Do we want to close out and redial back in? Is that a good way to reset? Or we can do it by phone if we want.
No, I think we're safe because I'm the meeting holder, William, and I'm not seeing what you're seeing. So I think it's safe. I think it's just the 3 of us. So.
Okay. Great. Yeah. So Helen, please go ahead. I'm still seeing someone on the right. And, okay. It says in this meeting 4. But maybe.
Do you want me to set up a link and send it to the 2 of you?
Yeah, that'd be good. Thank you.
Okay. Let me do a quick meeting. I'll send you the link and we'll get back
Great.
on.
We'll stand
Okay.
by. Thank you.
Okay. Bye.